Getting 2 weeks ready for a hurricane or other emergencies in Hawaii can present challenges.
Stockpiling 14 days of food, water, and other supplies is hard enough, but when members of your ohana have medical needs that must be met during a disaster, it can leave you feeling extra vulnerable.
Planning is crucial to meet those needs. For medications your household members must have, try to refill prescriptions a little early so you can always keep a 2-week cushion supply on hand.
After a hurricane, pharmacies may be closed and post office deliveries delayed, so you can't count on getting quick prescription refills. If you're down to your last few pills when you hear about an incoming hurricane, seek a refill right away. If your medication needs to be refrigerated, check with your doctor about how long it safely can be stored at room temperature in case the power goes out. If it goes bad quickly, you may need a cooler and ice packs or a backup power supply.
A generator or other power supply may also need to be in your plans.
If someone in your ohana relies on an electrically powered medical device, talk to your doctor, health plan, or county if you need a powered medical device and have no emergency power supply.
If your home medical needs include wound care, make sure your emergency kit includes enough dressings and antibiotic ointments and other needed medicines for 2 weeks.
Medical needs during emergency can quickly develop into serious health issues. When in doubt, call 911 or seek other help before an infection or other problems become critical.
Good hygiene in an emergency can help reduce the risk of medical complications. Next episode, we'll explore that topic.